How about flexion extension of the sacrum? Okay. Anytime you hear SI joint flexion, so left SI flexion, we're talking about the sacrum moving in relation to the ilium. Okay. So if I ask for left sacral flexion, it would look like this. So the sacrum, and this is the ilium on the left side, this is the sacrum. The sacrum would flex forward, the ilium would rock backwards. If I asked for sacral extension on the left side, it would be the opposite. The sacrum would go back, the ilium would rock forward. Does that make sense? So anytime you hear any kind of motion in the SI joint, think about where the where the sacrum is going. Okay? So, is it okay if I pull down your pants just a little bit? Okay. For prone flexion of the SI joint. So what am I specifically talking about? The sacrum, right? What you do is contact the SI joint opposite side from where you're standing. So if I asked for the left side, you guys would stand on the right side and contact the opposite side, okay? You would contact with your fingers right over the SI joint. You can contact with your finger pads, or you can also contact with the palmar aspect of your hands, okay? It's easier to feel with your fingers. So what you do is you ask your patient if it's around for you to reach around and hold on to the front of their hip. What you're trying to contact is their ASIS, but you don't tell your patient that because they're not supposed to know what an ASIS is. Okay. Allison, is it okay if I reach around to your left hip on the front side? Okay. So I'm going to come around and contact her ASIS on the left. From here, what I would do, just relax, I would bring her ASIS back and try to pull her ilium back towards me. What should happen to her sacrum if I bring the ilium back? Exactly. The sacrum should fall away from my contact because this motion happens. Okay? So what happens is I'm using the ilium to help me induce flexion of the sacrum. You bring and you're just feeling for motion. You're feeling under your contact to see if the sacrum rocks away from your hand or if it doesn't. That is prone SI joint flexion. Please don't get it confused in your head because you're actually bringing the ilium back. A lot of people do that motion for extension, especially on practicals. Now, to induce SI joint extension, again, you would have the same contact, so you're still contacting the SI joints, except with your other hand this time, you're going to come right over the sacral apex. Straight arm, don't lock your elbow, okay? So what you do is you lean in with your body on the apex, push a couple of times. What should happen if I'm pushing on the apex? What should happen to the sacral base? It should come back up towards me, right? So I'm pushing on the sacral apex to bring the sacrum back up towards me. Does that make sense? So that would be sacral or SI joint extension. Any questions?